Best Cosmetic Paper from Plastic and Reconstructive Surgery Journal. So exciting.
I know,
It's awesome. The Injectable Safety, New Concept and Best Practices in Hyaluronic Acid Filler Safety. We're so excited. We're so honored. Julie here does the majority of our injectables. So Julie, share with the entire world what this means to not just other practitioners, but the public that may be using this as a resource.
Yeah, absolutely. So the paper kind of reviews about 35 articles narrowed down to basically look at safety methods when it comes to hyaluronic acid fillers. It's terrifying the amount of patients that I'll get off the street or somewhere who are like, I've had something done somewhere and no one explained any risks. So the paper basically reiterates the importance of going to someone or a practice who knows what they're doing, knows their anatomy, has a plastic surgeon on hand to help out with any issues that may arise as well.
I couldn't have said it better. That's awesome. I loved how you said it's terrifying.
Terrifying.
Because we're not trying to sensationalize this, but we are trying to point out to the public that there are real risks that come along with the real benefits. And patients are looking for these benefits, but they're counting on us to help educate and mitigate those risks. And then to help steer them in different directions so that they can get the best treatment, the best outcomes, and that they understand what the limitations of some of these fillers can be. Because if all you have is a needle and filler, you cannot solve all the problems that come up in aesthetic medicine.
And so you can really hurt someone.
And you can really hurt someone. And that has to do with injectables into vessels, causing occlusion, migration. There can be overfilling that can lead to that, that pillow face. And then what's really fascinating that we're becoming more and more aware of today is that we used to tell individuals and patients that all of these fillers melted and went away in a couple of months. It's really not true at all.
No.
It turns out that these fillers are sticking around for a very, very long time. And some of the complications and issues that we're seeing in the tear trough area are that these fillers can block up and clog up the lymphatic channels. And these can be very, very challenging to address these. You can put in hyaluronidase to melt this away, but then you can be left with the subsequent sequela to this, which, the tissue may become very boggy and very overfilled. And, do you need a blepharoplasty? Do you need some sort of laser treatment? What are some of the other treatments that you can do on top of that? And so we always talk about the aesthetic ladder and look for a practice where you can get practitioners who can help you. I don't want to say from, beginning to end of the process, but from the most rudimentary treatment options all the way up to the most complicated. That would probably include a deep plane facelift. And so Julie and I working in tandem, and we also have Shannon helping us a lot, as well as Emily, who's new on board now, to give us options for the full spectrum of treatment. But the reason Julie and I are sharing this with everybody is it's very cool to have won Best Cosmetic Paper from Plastic and Reconstructive Surgery Journal. I mean,
absolutely.
Best means best.
Best means best.
Best, and we're like the best, and we're proud of it. And this means that we're able to give you these great treatment options as well. We're going to finish with our new tagline, which is, this practice is all about giving you the greatest. And so if you want to be greater,
see Dr. Claytor and Julie.
And Julie. It was so awesome.